In this video, we'll be taking you into a tour of how we conducted a research about oral health sustainability based on dietary analysis in the UAE population. That is 10.08 million. However, the main center of our study was Fujairah, which has got 64,860 in population. Their audience. Health by World Health Organization is defined as a state of complete physical, mental and social well-being and not merely the absence of disease or infirmity. World Health Organization has identified oral health as one of the most important public health priorities in the world. Despite the great emphasis of World Health Organization on oral health, it is still one of the public health problems even in developed countries. There exists a bionic relationship between diet and oral health. A balanced diet is correlated to a state of oral health, periodontal tissue, dental elements, quality and quantity of saliva. What we eat has a significant impact on our overall health, so there is no surprise that our diet also affects our dental health. Nutrients found in fruits, vegetables, nuts improve our body's ability to fight the bacteria and inflammation, helping to protect our teeth and gums. Diet influences the health of the oral cavity, conditioning the onset of cavities, the onset of dental erosion, and the state of dental health. Moreover, it is reported that there are more than 1.3 billion smokers worldwide. The World Health Organization estimates that tobacco causes nearly 6.4 million deaths and hundreds of billions of dollars of economic damage worldwide each year. And as dentists, we have observed most of our patients have smoking history for many years, including cigarettes, shisha, cigars, and e-vapes. More than 60 toxic chemicals in tobacco can invade the body's various systems. Oral cancer is accounting for over 90% of all cancers. More than 180,000 cases of oral cancer occur every single year, and approximately 90% of which are due to smoking. If current trends continue, by 2030, tobacco will kill more than 8 million people worldwide each year. The rationale of our study is to evaluate how diet, lifestyle, and habits such as smoking is impacting oral health condition in the UAE population through a survey. Also, it helps to educate our population about better oral health because it is the most simplest and cost-effective way to develop oral hygiene sustainability. When we say oral hygiene, it means the general health of our body, because according to new research, oral cavity is a window of different general body diseases, such as cardiac disease, respiratory disease, and rheumatoid arthritis. The aims and objectives of our study are developing a better understanding of the oral health conditions of the UAE population through dietary analysis, providing healthy nutrition guidelines that protect against dental caries and bleeding gums, discouraging smoking, unhealthy food, and motivating to maintain better oral hygiene and healthy lifestyle.
This is a cross-sectional survey-based study, which included an age group ranging between 8 years and 75 years. The sample size was 500, and we received the response from 250 participants. The study conducted in two phases. The participants were provided a dietary chart to fill up and return to the clinic for an oral health examination. The dietary chart was included one weekend and 3 working consecutive days. The dietary analysis was performed and the instructions to the individuals were tolerated based on the medical, dental history, social history, oral examination, diet analysis, lifestyle, and maintenance of the oral hygiene. In the second phase of the study, the students of different colleges and faculty members of the University of Science and Technology of Fujairah were invited to visit our dental clinics. They will be provided with a dietary sheet to be filled up prior to the clinic visit. All young adults' diets will be analyzed and recorded. This will assist our dental graduates to customize the oral health instructions for the participants based on the medical and dental history. Oral examination, which includes soft and hard tissue examination, gingival condition, periodontal health, tooth decay, and erosion.
In this study, t-test and ANOVA was applied for the statistical analysis using SPSS version 23 at a significance level of probability less than 0.05. Descriptive statistics, mean, standard deviation, and frequency distribution tables were used to describe the collected data. The DMFT index, which is decayed, filled, and missing teeth index, and the British Periodontal Examination codes were assessed at different levels of the independent variables through multivariate general linear model analysis. Also, the relationship between independent variables and the DMFT index was evaluated using Pearson statistics.
The mean of standard deviation values, decayed, missing, and filled teeth, with those participants who were brushing their teeth with different frequency per day, such as no brushing once a day and 2 times, was reported statistically significant. Likewise, people who were flossing with different frequency, their DMFT mean was reported significant as well. However, the DMFT mean was similar in both genders. As shown in Table 1, 57% of the participants reported that they were brushing their teeth once a day. In addition, 54% and 85.7% of the subjects, respectively, reported that they were not using dental floss daily. This resulted in poor oral hygiene in 51% of the population. The results obtained from the dietary charts applied to the participants demonstrated that the frequency of developing high risk of DMFT was recorded 54% in male and 48% in female. Likewise, BPE codes recorded in both genders were similar and significantly related to smoking. The results demonstrated that the periodontal condition BPE code 3 was associated with the frequency of smoking, which is significant, and intake of high sugars. There was a statistical significance of periodontal health condition with the smoking indices with high and low sugar diet intake and smoking habits in the UAE population. Dear friends, the food for thoughts for today is: oral health condition of the UAE population is significantly affected by unhealthy food, lifestyle, smoking, and improper brushing and flossing. This results in bleeding gums, gum swelling, tooth and bone loss, and other systemic conditions. However, an appropriate mouth cleaning and maintenance of oral hygiene could simply develop a healthy mouth condition with an everlasting smile.
Hello everyone, my name is Erum and I'm one of the mentors of the project. I personally believe that the prevention of oral diseases should be recognized as the most sustainable way to ensure optimal, accessible, and affordable oral health with minimal impact on the environment. The reason to design the study was to evaluate the impact of diet and lifestyle on oral health condition in the UAE, because we noticed that many individuals and young adults reported to our surgery represented high prevalence of poor oral hygiene, bleeding gums, and decayed teeth. It was an amazing experience to supervise our undergraduate students. They worked persistently hard, not only to undertake the research, but to educate our community, especially young adults, about oral health sustainability through healthy diet and lifestyle. This is just a beginning, and another milestone needs to be achieved. It is such a wonderful collaboration of an institution with the community health development program. The research significantly integrates with the common well-being of the United Arab Emirates community. Eat well, UAE, and keep smiling. Thank you very much indeed.
The concept of sustainable development is based on 3 main pillars: the environment, the economy, and society. The promotion of good oral health habits combined with the access of all people to health services together make a significant contribution to the welfare of population in the United Arab Emirates, and could also contribute to achieving environmental goals as well as enhancing inclusive, productive, and healthy lives. Oral health sustainability involves many stakeholders who all have a role to play. The value of our current project is the thought of healthy nutrition for healthy teeth, which summarize the effect of nutritional status on the human dentition from pre-eruptive stage up to possible early loss of teeth, which reflects clearly the impact of oral health sustainability on the overall well-being of a person.
Let me introduce you to the group of the study: Dr. Erum, Dr. Tamer, Ahmed, Yaqeen, Humam, and Muhammad.